Most of us are now familiar with the health risks that obesity can cause, but did you know that being obese during pregnancy can also put you and your child at risk for severe pregnancy and health-related complications? Well, we're learning more today from Dr. Sharon Phelan, who is a doctor with the UNM's Department of Obstetrics and Gynecology, and you are here to explain a little bit about this. First of all, this is kind of a gray area for a lot of folks. Define obese for us.
Obese is usually a weight that makes you more at risk for problems.
Okay.
And we determine that by looking at height and weight, and there's various ways to do that. The best way right now is body mass index, and you can just Google that, BMI or body mass index, and they'll come up with calculators. You can put in your weight, your height, and it'll tell you what your BMI is.
Okay.
Currently, a BMI of over 30 is obese.
Okay.
Over 40 is type 3 obesity or morbid obesity.
Morbidly obese. Okay, great. Now, how common is obesity during pregnancy?
It's gotten quite common.
Really?
In the general population, about a third of people are obese, a third of people are overweight, and a third of people are normal weight, healthy weight, or less. In pregnancy, about half of the people are either overweight or obese. And the most concerning thing is that 1 out of 15 pregnant women have what we call type 3 or morbid obesity.
Really?
Coming into the pregnancy.
Wow. Okay, so now going into the pregnancy, what can expectant mommies do to prepare for that? Maybe getting weight off or something?
Now, unfortunately, only about 50% of pregnancies are planned.
Right.
But if you're planning a pregnancy and you know you're obese, do not try to get to a healthy weight in a matter of 6 months. Then you're going to do crash diets. That's
Right.
not healthy.
Right.
What you need to do is start changing your lifestyle to be healthier. More activity, walking is great. You don't have to join a club. Starting to eat healthy. Lots of vegetables, fresh fruits, meats, avoid the carbs, and by eating healthy, getting good nutrition, you'll probably find you will lose a little weight, but you'll also be better prepared for a pregnancy.
Right.
You can go to the CDC website or March of Dimes website and look for eating or nutrition in pregnancy, and they will give you lots of guidance.
Okay. Now, what are some of the risks that women face during, and complications really, during pregnancy and delivery if they are obese?
If most women will do okay, but you are at increased risk for making a very large baby.
Okay.
Large babies are harder to have. You end up more risk of needing a C-section or the baby having problems with the delivery. The other problem is for mom. If you put on a lot of weight during pregnancy, or if you go into the pregnancy quite overweight, you're more at risk for developing diabetes, high blood pressure. You're more likely to have twins, which is most people don't realize.
Really? Wow, I didn't know that.
Yeah. And a lot of folks, then these complications of diabetes, hypertension, and so forth can put you at risk for actually making a smaller baby, needing to have a preterm baby, or other complications.
Okay. Now, what are some of the long-term effects that can come from this?
The long-term effects, for mom, one of the biggest sources of obesity for women is excessive weight gain during pregnancy. Because it's very hard to lose afterwards. So a woman who goes into pregnancy obese should really gain probably about 15 pounds.
Okay.
More than that is mom's weight and is likely to hang around, shall we say.
Okay.
The obese women, as we all know, are at increased risk for the diabetes, the hypertension, heart disease, so forth.
Right.
The problem for the child, though, is we're finding out more and more that it appears that when a baby is growing inside a woman, it is getting pre-programmed for certain things.
Really?
And for
Okay.
a baby to be very, very large because it's fat at birth, or to be really, really scrawny and skinny, seems to program those children to have much greater increased risk for obesity in childhood and adulthood, which
Wow,
then sets them up for ongoing
Yeah,
challenges
absolutely.
and problems.
Absolutely.
So again, the more we can help a woman watch her weight during pregnancy, the more effective we'll be at sort of not only helping her, but the whole next generation.
Right.
So
And that, that makes a lot of sense. And it seems to me that's something that, a lot of parents may not think about. Of course, my wife and I, we have a little one, and we tried to be very careful and very healthy during pregnancy. More, for the health of the baby while she was, while my wife was carrying her. But really thinking about those long-term effects on the baby and that pre-programming, like you say, I don't think that's something that a lot of folks are really aware of.
And that is an issue. But the other thing, I really like to work with women when they're pregnant because people are, just like you said, you and your wife, are incredibly motivated to do all that they can to make the best pregnancy. That's a great time for them to learn to change their eating pattern, not only for the baby while it's inside of them, but continue that eating pattern once, that healthy approach to eating.
Right.
After the delivery, you teach the child to like those foods.
Right.
What kid likes broccoli? Not a whole lot, but if you eat it during pregnancy, the child may accept broccoli more readily after delivery.
Right.
So you're setting your child up for a better life.
So if we're want to just put something up here, information, so if folks want to contact you, we're looking here at the Department of OBGYN. They can reach you at this telephone number, 272-4051.
Right. Now that is what we call the academic office. And they will probably be referred over to the clinic area, which is 272-2245. They can also use that web address, but if they're like me, you're better off probably just Googling Department of OBGYN.
Great. Well, thank you so much for your time. Appreciate the information.